So we have a select three. It states which findings are most consistent with emphysema. Would it be A, low grade fever, B, non productive cough, C, barrel chest, D, stridor, E, drooling, or F, tachypnea? Now, of course, before we start answering this, we got to talk about what is emphysema. Emphysema is found with our COPD patients. This is a irreversible but progressive disease. Now, these patients suffer from permanent damage to the alveolar walls. They have air trapped inside of their lungs. They have a loss of elasticity. There's a lot of problems that occur with the actual lungs themselves. Unlike the other form of COPD known as chronic bronchitis, where there's a lot more mucus production. Now, looking at these answers, there's a lot of signs and symptoms that we would see with respiratory emergencies, but there are only three here that we would have with emphysema. Now, let's go ahead and take a look at some of these answers that we wouldn't see with emphysema, starting with E, drooling. Drooling makes no sense because drooling patients are unable to swallow or have difficulty swallowing. Not something that we would see with an emphysema patient because this is not an upper airway problem. Leading to D, stridor not being an issue either. This is with emphysema, it's much more of a lower airway issue. And then the last one, A, low grade fever, is not commonly seen with an emphysema patient. Now, a non productive cough, kind of a weird answer that I would see in a test question about emphysema because typically when I think of coughing, I don't think of emphysema. But with regards to COPDers, remember their chronic bronchitis patients will have a productive cough, but if their emphysema patient is coughing, it would be considered non productive. So, again, not the best answer in the world, but with what we got here, definitely one that I could choose. The other is barrel chest appearance. Barrel chest appearance is just because of that air trapping that's inside the lungs and their chest is overexpanded. Then the last one here, tachypnic, is a sign of a patient that is in respiratory distress, right? So often found with a patient with COPD exacerbation. Remember, these patients are chronically hypoxic. A normal SpO2 may look like anywhere between 88 to 92%, and that may be completely normal for that person. So I hope this helped talk about emphysema. If you have any questions, as always, let me know.